Through Instagram. Okay, well, thank you for joining me today. We've got a really important topic here that we talk about a fair bit, but it's something that in society, I think there is a little bit of misinformation around how snoring affects our health and how breathing affects your overall well-being. And I'm here to talk with Dr. Rad, and we're about to kind of go deep into the connection between the mouth and breathing. Thank you so much for joining me today.
Thanks for having me on. I'm excited to talk to you about this because guess what? A third of our life is spent sleeping, right? So how well do you sleep, right? How great of a restful sleep do you get? Are you tired throughout the day? Do you snore? Are you annoying your bed partner? Or do you even know that you snore? How can you figure this all out? And if you don't have a bed partner. So yeah, let's dive in. I love this kind of stuff.
Yeah. Dr. Radford, you've kind of changed the way you practice dentistry in order to kind of, really bring in this whole piece of such an important, centerpiece of people's health, which is sleep. Take us back a little bit before, maybe as you were starting to kind of, look into all these areas, how did your view of the world, begin to change in terms of the importance of breathing and its connection to teeth? And what were kind of your first perceptions? Because this isn't something that is taught in dental school. So how did you find it all?
It's funny. I went to USC School of Dentistry in Los Angeles, California, and I graduated 22 years ago in 2002. And 2 nights ago, I was actually presenting to 82 USC students about sleep. And I asked them before I started the presentation, because I teach the courses on sleep apnea and snoring to dentists. And I said, has anyone taught you this stuff? You guys go over it all? And these seniors kind of looked at me like, not really. We know that there's a mouthpiece out there. And this is the graduating class that's going to be coming up. And it's kind of sad that a prestigious dental school such as USC here in America, the School of Dentistry isn't really diving into knowing that dentists are really one of the biggest key factors here in helping someone snore less and breathe better as an alternative to wearing a CPAP machine, which unfortunately a lot of people cannot tolerate. And so my journey was in 2002, I became a dentist. I didn't even hear about this because really the oral appliance or the mouthpiece was put on the map in 2010 when the American Medical Association and Dr. G at Stanford really saw the efficacy of and I have one myself, my own mouthpiece that I made for myself after I fell asleep at the wheel. I crashed my car into a tree and had no idea I had sleep apnea, and I became patient zero in my office. I went through the process and I did a home sleep study. Luckily, we can now do home sleep studies to figure out what kind of level of sleep apnea we have. And sadly, I couldn't tolerate the CPAP machine, but my condition is mild. And so I was one of the first ones to make an oral appliance. And since then, I've incorporated into my practice, into thousands of dental practices in the United States.
It's actually a self-discovery process that I think a lot of people go through. We have it a lot in the practice as well, where you kind of ask about this breathing piece, and there's just no kind of idea that it could be so influential on your health, right? And then once you start thinking about it, it's like, oh, hang on, there's all these warning signs that are kind of there. And then you realize, hey, I actually do wake up pretty flat in the morning and I don't have that energy to get through the afternoon. Then all of a sudden they're starting to, be a little bit mindful about how we're sleeping and how we're kind of, that's affecting our health. And then it just opens this Pandora box kind of into a world that is sometimes a little bit hard to interpret. But can you remember a little bit about that kind of, obviously, like that must have been a big moment for you, crashing your car. How did you start to interpret the way you were feeling and sleeping in terms of, how did that start to kind of influence what you implemented after that?
Yeah, at the time I was being told, especially if I had a couple of cocktails, that I was starting to snore. And mind you, back in 2009, I was 165 pounds and 6 feet tall, so I'm not overweight. So you don't have to necessarily be obese or overweight to have snoring or sleep apnea. And I was feeling a little more grumpy in the morning, not as happy-go-lucky as I am now. The positive mindset. Let's talk about mental health. even in 2009, when that wasn't a very common phrase of mental health and depression and anxiety, I was having some of those symptoms of just not being as happy-go-lucky in the morning. Maybe after a cup of coffee kicked in, and maybe then you feel a little bit more energized. But energy going down, that's the falling asleep at the wheel. Here in America, we have 4% of crashes are due to people falling asleep at the wheel. And so snoring is an indication, feeling tired throughout the day. And then there's some other kind of what we call in dentistry obvious things that we can see are a grinding of your teeth. If you're, anyone listening here, if you grind your teeth and if you look at your lower front teeth, if you see them wearing down, they're starting to, look like someone kind of burnished them down and it's chipping or wearing. That's you doing your own kind of grinding and forward movement of your jaw to open up your own airway. That's kind of what the mouthpiece does, is it brings you slightly forward, your lower jaw. We call it a mandibular advancement appliance to get more room. It's like a CPR position for your mouth, so that for your jaw, so that you can get that air in. A lot of other people, when I look in their mouth, I see striations on the side of their tongue. We call it scalloped tongue. You can Google that and see what that looks like, and then stick your tongue out, look in the mirror, and see if that's happening. And that's kind of a self-assessment I have whenever I talk to my patients, and they look in the mirror with their tongue and see if there's any scalloping. That's their tongue being pushed forward every time they have an apneic event, because the tongue hitting the back of the throat or that soft palate is what the vibration is, where the snoring happens, and then the suction against that back of the throat is what sleep apnea is. So tongue hitting against the back of the throat, thrust forward as a fight or flight kind of response, and you grind your teeth forward, it hits the back of the teeth, and that's where the scalloping occurs on the side of the tongue.
Yeah, the teeth grinding is one that's common, isn't it? But that's kind of something that can be done silently as well. A lot of people just don't know they do it. And so sometimes in these conditions, we find that there is such a wide spectrum of presentations that you can have with sleep, but then only the very severe are being discovered, right? And so, if you have to go and get a sleep test to kind of discover that you have some level of obstructive sleep apnea, that's a whole kind of spectrum that has kind of come to that point where you've got this time where your airway is actually closing and pausing through the night. And it's just such a crazy concept once you've kind of looked into it a fair bit, and it's such a little bit frightening in a way that we have to get to that point to understand we have this condition. Let's talk about that to start with. Let's talk about how we diagnose sleep apnea and the different levels. You mentioned you had mild sleep apnea, was that right?
Correct. Yeah. And as dentists, we aren't allowed to diagnose it here. We are allowed to screen for it and treat it. Screen for it means what I just talked to my patients, the grinding, the scalloping of the tongue. But a lot of times we can also look at their medical history and see the comorbidities or things that are associated with sleep apnea, such as high blood pressure, acid reflux, depression and anxiety, history of heart attack, stroke, cancer risk. University of Wisconsin had a new recent study done that 5 times higher risk of cancer of any kind if you're not being treated on sleep apnea. So you got to figure out what severity, as you were talking about, is the sleep apnea, and it depends on the number of times you stop breathing or have a shortness of breath that affects that pulse oximeter that you have on your finger doing that home sleep test. Luckily nowadays, obstructive sleep apnea can be tested at home, because let's be real, doc, we don't have too much time to go to a sleep in a lab, and people get deterred to even want to know because of that roadblock. And the roadblock is reduced that you can do a home sleep study. And if you stop breathing or have shortness of breath by at least 5 times an hour, you've got the scarlet letter, the stamp of approval that you have sleep apnea. And 5 to 15 times is mild, and 16 to 30 is moderate, and anything over 30 is severe. And patients who are really severe should really be on a CPAP, that mask machine called continuous positive airway pressure. But a lot of dentists can help their patients who are mild to moderate or under 30 times an hour. Have I helped someone with over 30 times an hour stoppage of breathing? Absolutely. But we can't really successfully get them to healthy. We can bring them down, but it's not as successful as the numbers go up. But that sleep study is so crucial, and it's so easy to do nowadays at home. Most dentists who are trained in this can refer, but usually a medical doctor can refer you or a sleep physician to get that sleep test done and get checked and evaluate, see where your number's at.
Yeah, so that's that's a polysomnograph that, as you say, can be done at home, but yeah, is probably more commonly still done in labs, and so it can kind of bring back results that are a little bit funny in that sense as well. Because if you're sleeping in a lab, you're obviously not sleeping how you would at home. Let's think of. I think we most commonly find that a family member or a partner, will report that sleep isn't great, right? So there's those signs and those kind of, sometimes complaints we have from people that are around when sleeping, that there's noise or there's certain things that they're noticing during sleep. What do you have? Do you find that partners report this a lot and that they send them to your clinic a bit? What do you find that they're reporting with sleep?
So one of the coolest feelings as a dentist is we thought we are just going to work on teeth and cleanings and veneers and whitening and, and pulling teeth, which is, always sometimes a possibility. But one of the best days I have is when I give a sleep appliance to a patient, male or female, and everything's working great. They come back in a week, their snoring's gone, they're very happy. I love seeing their bed partners show up with them. I've had them come give me a hug and be like, hey, John and I are finally back into the bedroom together, or Sally and I it saved our marriage, it saved our relationship. I've got one little fun tidbit for you. Imagine that you're newly single, right? Sadly divorced, newly single, or maybe even happily divorced. And what happens is you end up dating again. And your bed partner or your wife or husband, ex in the past, was kind of dealing with it. Earplugs, heavy sleeper, maybe didn't really affect them, or you slept in different bedrooms, and now you're new on the dating scene. And you're going and you're dating someone, and all of a sudden you have a first night of an intimate moment and you sleep over, or they sleep over. Where are you now? Right? I mean, where does the relationship, how does it start? And unfortunately, snoring ramps up as we age because the soft palate droops and sags like everything else in the body, and the tongue grows in size over time because it is a muscle that we use, and the distance between the tongue and the soft palate gets less as we age, and so the snoring increases as we age, and so it's an embarrassing thing. It's not just a medical and save your life and all this other stuff. It's also a social embarrassment. Let's say you and I were going camping or with a boys trip, right? And we're staying in an Airbnb. There are people sharing rooms together, and they're like, man, Steve, what's going on with you? We couldn't sleep last night. And there's an embarrassing part there. And that's why it's kind of important to, as a bed partner, that when you hear someone snoring, it's not just push them to the side so they can get on their side and hopefully reduce their snoring, because the tongue doesn't fall back as much when you're on your side. But it's also, it's good for them to start getting tested and knowing that there's treatments out there that's not just a CPAP machine, and oral appliance can really effectively reduce their snoring so they're not as embarrassed when sleeping next to a bed partner.
Do you find that there's a little bit of a more common unawareness that a person is snoring from the actual patient themselves, and there's been this kind of other signal that has got them to come to you? Or what do you find that people with obstructive sleep apnea are reporting to you? What are they feeling, and what have you found with your investigations?
Yeah, if you don't have a bed partner and you technically don't know that you snore because you haven't slept next to someone, there's apps out there that can test, or you could record yourself. I recommend, and I have no affiliation with them, called Snore Lab. It's an app that you can download for free, and it'll record your snoring. And you can listen to it in the morning and see how bad you were. You test it with some alcohol and test it when you have a heavy meal, and you kind of see the difference, right? And so there are apps out there, if anyone that's listening that's concerned, hey, I don't know if I snore. So that's the number one indication. But really, again, we go back to just feeling more tired throughout the day, having a little bit more anxiousness, because mental health is affected by sleep apnea, and mental health affects your sleep in return. So when you have anxiety throughout the day, it's harder to fall asleep. That causes more insomnia. But let's say you don't have that as much throughout the day. It's more because you have sleep apnea and you're not getting enough oxygen. There's lower levels of serotonin. And so it is estimated that 46% of depressed patients is a result of sleep apnea. So that's almost 1 out of 2. And so those are some of the tail signs, like, just not as happy. Life is hard. Everyone goes through suffering, and we're all very thirsty and in need of emotional healing and feeling togetherness. And we've gone through a lot. Everyone has traumas that they've gone through. And the last thing you need is not being able to get good sleep to work through all this pain and suffering that life can bring you. And sadly, we just throw it on over busy, over stress, or woe is me. But at the same time, again, a sleep test, whether you do it in the lab or at home, can really give us some insight to push you over the hump so that you can deal with these symptoms of feeling tired, feeling a little bit more anxious, depressed. And then again, we talked about those medical conditions. If you're already taking medication for high blood pressure or borderline, or you're diabetic type 2, or you have acid reflux issues, you should be getting a sleep test because those are all comorbidities or related to sleep disordered breathing.
Yeah, the evidence and the publications which have come out more recently on the effect of obstructive sleep apnea for systemic conditions. Most probably recently is Alzheimer's dementia, which is that really scary one where you're talking about how you're feeling. It's like, well, that drop in serotonin neurotransmitters seems to in combination with the lack of oxygen during sleep can starve us out to the point where we are losing the ability to kind of sometimes make memories and consolidate memories, which is just really frightening. But it's just that piece is how important it is to understand how the airway is working in general, and then also during sleep. Tell us a little bit about how you kind of go about investigating obstructive sleep apnea, or if you're a little bit kind of more suspicious of certain other sleep habits like teeth grinding. How do you investigate a person that is presented to you like this?
So any new patient that comes into my practice, and I advise this to any dentist, is there's a form to fill out that has a little questionnaire about some of the medical conditions that are associated with sleep, and some questions like, hey, do you fall asleep sitting in the passenger seat pretty quickly? Or when you're watching TV, do you fall asleep quickly? When you're reading a book, the first page, do you fall asleep? These are some tail signs or questions. You snore. That allows us to have that conversation where I look at this form and I go, okay, Steven's have some sleep issues. Maybe I can ask him if I can help him and guide him to getting a sleep study and eventually some treatment. So there's a start there. We call it a screener form. And then the patients that are already in the chair, again, when I'm looking at the size of their tongue relative to the size of their jaw, I'm looking at if they're mouth breathing and they have dry mouth and more tartar buildup. Sometimes on the lower front teeth, we see a little bit more tartar buildup with the mouth breathers. That they could have more obstruction up in the nasal cavity, and that can indicate sleep disordered breathing. And then, of course, we talked about the grinding of the teeth. When I look at the teeth, I look to see if there's any acid erosion, meaning the GERD or acid reflux that comes up can melt away the enamel, and you start seeing the orange layer, which is called dentin, the inner core of the tooth. And when that orange layer is exposed, again, how well do you sleep at night? Does anyone tell you that you snore? Do you feel more tired throughout the day? Would you like me to help you? Anytime I see little notches near the gum line, we call those abrasions in dentistry, or little class 5 lesions is the technical term. And we put little fillings in there. Those aren't just because you brush too hard. It's because there's grinding patterns and reflux that come up. And those grinding patterns and acid reflux can melt that root structure away, and the gums recede. And that could also be a kind of like a CSI, crime scene investigation kind of exam, where I'm looking for all these little tail signs. And then it's just, hey, have a conversation with the patient. If you as a patient or as a person feel like you have some of these things, bring it up to your physician, get tested for sleep, or your dentist if he or she does anything like that in their office.
There's obviously the published numbers, in terms of how common this is in society. That is saying 1 billion people on the planet now have sleep apnea. Like this is diagnosed sleep apnea. My mind kind of goes what the real numbers are, because like the tests that you're talking about, even though they're quite well established now, they're still quite obscure. Not many people do have access to this. What's your feel from what you've seen from patients as to how common these conditions are, and how many people are actually experiencing this in society?
Yeah, so the initial numbers were 20% of the U.S. adult population has sleep apnea. That's creeped up to 30 now. So that means that 20 people coming into your office tomorrow, Doc, out of the 20 people, 6 are walking in with sleep apnea. Now, the good news is a lot of people in the last 2 or 3 years have done some sleep studies. They've already tried to remedy this. And unfortunately, majority of these people who have gotten sleep studies have gotten CPAP machines and they failed, meaning they can't tolerate it. It's too uncomfortable. The straps are uncomfortable. And even though you and I are both really big believers of the continuous positive airway pressure, that if you can tolerate and use it, it's really a very, very good tool for most patients. They love it if they can tolerate it. But the second line of defense is really the oral appliance. And in some thought processes, it's really the first line of defense, because if you're a mild to moderate patient, how much easier it is to travel, and you're going to be more likely to wear this 7 nights a week. If you get up to go to the restroom, you don't have to take the whole contraption off. So, it looks like to me, more like 3 out of 10 patients, adult patients that are walking in, have some sort of sleep apnea. And the majority of those are mild to moderate. So that's a very good sign that dentists can help, so that they're just not left out in the dust. These patients that, I can't wear that mask. It's embarrassing. Again, we talked about that social well-being, putting that mask on the first time after you're intimate with someone, really tough thing to do, right? We talk medical, we talk dental, but really this is a very, very emotional subject. It can be very embarrassing, and to be able to put a mouthpiece in that's an upper and lower mouthpiece, it looks like a night guard. Really, it can really reduce all these symptoms and the snoring. It really does help those patients that, let's call it, are about 30% of the population that I feel.
Absolutely. And you mentioned the difficulty of snoring with a partner, or sometimes if you are meeting new people, then it's like you're kind of, you've got to kind of broach this very awkward social situation. And as you say too, like, it actually does separate a lot of couples, which is a very difficult thing to kind of go through, where you've got to work through that process of not being able to sleep in the same bed. That's a very difficult thing to, for families and, just in general to broach. You mentioned that, so for most people, right, if they realize they have a problem, like they're going to go to see either their sleep doc, or they get referred in for a polysomnograph, which will either be at home or in the lab. They get a diagnosis, whether it's mild, moderate to severe. Severe is probably less common, but there are people out there that have it. But then they're given this option of a CPAP machine. And what you're saying is that a lot of people are failing, and the numbers are quite high that people are failing on CPAP machines. But it does work for certain people. And I like to kind of think that sometimes there's a stepped approach to this. Like, how can we, one, get things settled, but then also, two, how can we support this more long term? But a lot of people don't get that option, do they? They're told that here's a CPAP and that's your one option. But you've obviously built this within your practice to kind of give people this second this second way of looking at it, and this second option to try to support the airway. Explain to us about how the oral cavity and the development of the jaw and the way we use the jaw and the soft tissues, how that affects our snoring, and how these appliances work.
Yeah, so you mentioned something very, very important here. The medical doctors who are, incredibly taking on a very huge role of so many different diseases and conditions. They hand over a CPAP machine and patient fails. A lot of them are now understanding that oral appliance therapy is a good alternative to CPAP machines. So a lot of the medical doctors in the community are referring to me, and then the patients are going back to the MDs and saying, Dr. Rad really helped me. And so they're like, wow. So a lot of my referrals, when I do these appliances now, majority of them are from medical doctors in the community. And I've done something very important. Stephen, when you come into my office and I treat you with a sleep appliance, I send a letter to every single medical doctor you've seen within the last 5 years. That's what I kind of teach in my courses, to educate them on what I'm doing with our mutual patient, which is you, for example. And then they get a letter from Dr. Rad and go, wow, okay, he's treating our mutual patient. Who is this guy? And, we do a follow-up. I like to go meet the doctor because, maybe sometimes I have a patient who has arrhythmias from the sleep study and needs a cardiologist. So I'd refer them to that cardiologist that I already have a mutual patient with. And that's the really good networking for them to know that a dentist like me in California is helping patients, including their patients already. And so when they see people fail with a CPAP, which really what the CPAP does is it blows air so that it pushes the tongue and the palate away from each other, just positive pressure of air. And the appliance, what you were referring to, the lower jaw has the tongue attached to it. And when you bring the lower jaw forward and don't let it fall back because of the little hinges that it has on the side of the appliance, and you can advance this appliance and migrate it millimeter at a time and bring that lower jaw more forward and lock the patient in. As you do that, you get more distance between the soft palate where that punching bag hangs out, called the uvula, and the tonsils. If you haven't had those tonsils removed yet, that soft palate that's pretty stationary is waiting for that tongue to fall back due to gravity, especially if you fall asleep on your back, and boom, suction, and that causes sleep apnea. So if you can migrate the lower jaw and the tongue is attached to it slightly forward, whether it's edge to edge or slightly underbite with the appliance, you're giving some room between the tongue and the back of the throat where that soft palate is. All we need is just a little small amount of room so they don't get that suction or that vibration, which is called snoring.
It's a common problem that people can't tolerate CPAPs, and so there's no kind of way off them, really, is there? Like discussed with the doctor, often because the doctor maybe doesn't have that interface or that discussion that you're mentioning, from a dentist that is using and practicing these techniques. What would you say that are some of the downfalls or some of the side effects or issues people have had with CPAPs that they're reporting to you?
Yeah, this is a great question because 1.5 million CPAP machines were recalled here. And a lot of people were displaced, so to speak, not knowing what to do. A lot of people actually still have fear about their CPAP machine if those plastic components are carcinogenic or toxic. I believe it was several hundred deaths reported with this recall that came out a few months ago as a report. And so, people are getting scared of the CPAP. And I'm a big advocate of it. I love the fact that it's been around since the 80s and it's helped save so many people's lives. But I get a little eerie that just even the mildest patients are right away just given a CPAP machine. I think that oral appliance therapy should be the first line of therapy for especially mild patients, meaning people who have 5 times to 15 times an hour stoppages of breathing. And then if that's not working with a sleep study with the mouthpiece in, which is what I do once I dial them in right, they're not snoring, they're feeling more energetic, they're dreaming more in the middle of the night, they're not getting up as much to go to the restroom because frequent nighttime urination is associated with sleep apnea. So these CPAP machines are given and the straps are too tight. If you're, it causes little indentations around the cheek area and you get actually permanent indentations there over time. It makes for dry mouth. Imagine sticking out your head out the window driving 30 to 40 miles an hour. Sometimes that's what it feels depending on the pressure of the machine and your score on the sleep study. It's very uncomfortable with this air being blown down your throat. And more importantly, if you toss and turn, it's the hose that's connected to it can kind of wrap around like the umbilical cord wraps around a baby in utero. So there's a lot of things to it. And if you do get up to go to the restroom, you got to take the whole contraption off, go to the restroom, put it back on, tighten it again. And that itself could just pivot you to staying up because it's already 4:30 in the morning and it's hard to fall asleep. And then there's the issue of cleaning it. And cleaning the machines has to be done on a daily basis to prevent the fungus and the bacteria to become aspirated when you put it on. I mean, in a mouthpiece, I have my little bottle of Rad Fresh. All you do is you do a couple little sprays and it can kill the bacteria. You can soak it in hydrogen peroxide and water. Some people brush it. I'm not a big fan of brushing. It causes little micro scratches in the appliances, but it's so easy to clean. It's easy to take with you. You don't have to take it out if you go to the restroom. And so the cleaning part of the CPAP machine is very annoying, especially when you're traveling, when you're on overnight flights. Let's say where you're going somewhere where you're camping, you're a big outdoorsy person. Where are you going to, plug it in? Where are you going to, how are you going to clean it? And so it's a great tool. Never take a CPAP away from a patient if they love it. But if they're failing, which close to about, I would say 70%, some of these numbers are showing that patients don't feel bad. About 100 people get the CPAP, 70 of them give it back because they're not wearing it. Those numbers are pretty high. Medical doctors will tell you, oh no, majority of them love it. And I don't see that because there are people are walking in 30 to 40 patients a month in my office. And most of them are referrals from the MDs that say, hey, our patient failed.
It's sometimes a point of shame too, where they're like, they know that they've got this condition, but they can't tolerate the CPAP, and then they actually haven't used it, and so they won't talk about it. And that's a worse off situation because the doctor thinks that they're using the CPAP and that everything's okay, but they're actually going home and sleeping and choking worse in their sleep than ever. But they think that there's no other solution, and they just don't talk about it. So it's a good point that you bring up. And as you were saying that, I was just thinking, like the way we see CPAPs as a permanent solution for sleep apnea, it could foreseeably be seen as like a life support period. It's like, right, okay, you've got this, let's put you on this for 3 to 6 months or something along those lines. But then, hey, we've got to be thinking about how your body is breathing coming off, because you also mentioned the facial effects, that the CPAP machine has, and that some people do have changes. Well, you notice this a lot in pediatric populations that have had early CPAP machine use, which is obviously life-saving, but then you kind of see those kind of facial development features where there's flattening through the middle of the face because of the pressure on the mask and the early development. And then we have to think about the effects of the child breathing going forward. So it's a really interesting, space where we see that people are falling through the cracks, right? And that, you've built this practice that really kind of helps catch these people and find solutions. How did you, actually, sorry, before we go into your office, I thought we'd talk a little bit more about the silent forms of sleep issues, because one other thing that you address is that TMJ problems and teeth grinding also is reported quite frequently in this population. Tell us a little bit about the TMJ patients that you see and the teeth grinding connection. And these are people that aren't kind of diagnosing for obstructive sleep apnea. How you go about this and what you're seeing that they're experiencing.
Yeah, it's crazy. The TMJ, or temporomandibular joint disorders, has exploded in my office ever since COVID. I want to say fourfold, including teenagers. They're coming in with popping and clicking of the jaw. They're coming in with migraines, headaches, neck and shoulder pain because of the punching causing the bruxism and the SCM, the neck and shoulder and traps and whatnot. Tightening up as a secondary to the cheek muscle and the temporalis, the masseter and temporalis tightening up. A lot of times I'm using Botox into the masseter and to the temporalis to loosen that up so they're not as tight. And we're making occlusal splints, or also known as night guards, that have a hard chewing surface. So when you grind on that, you can kind of slide your teeth back and forth. But a TMJ patient, if they have those symptoms of tired throughout the day, any sort of the medical comorbidities that we talked about, such as high blood pressure, reflux, diabetes, heart issues, arrhythmias, anything like that. And if I see the lower anterior or the lower front teeth wearing more than the back teeth, I kind of call a timeout. And I try to have them do a sleep study before I dive into just treating their TMJ with a night guard. And people just go and buy these boil and bake night guards and think they're protecting their teeth and doing right to their jaw, and it's not working. And so you really have to be evaluated to see if it's really a sleep issue, because it's known that about half of the TMD or temporomandibular disorders out there is an airway issue. You mentioned something super important and dear to me, and when we lead with our heart as practitioners and we look at children. And children are our legacy, right? We do anything and everything for our children. We have to understand that any child who snores is a huge red flag. Any child who grinds their teeth is a huge red flag. Bedwetting is a huge red flag. And we have this commonly happen to our kids. And so what do? Well, you got to have a pediatric ENT if you have any of these types of things happening. Evaluate the tonsils and adenoids to make sure there's no obstruction. Pediatric ENTs I refer to at least once or twice a month in my area when I see a child that comes in that has grinding patterns. My phase 1 orthodontics, meaning appliances that I do for kids between the ages of 5 and 12 before the adult teeth are in has exploded in my practice, because sometimes their jaws are too narrow for the tongue to sit against the roof of the mouth. And sure, we'd love to get those jaws wider so the teeth don't come in all crooked and buck and all this other stuff. But that's not the real main reason I do it in my head. I'm doing it to get more room so that the tongue has a place to sit so it doesn't fall back when they sleep. And man, have we seen growth spurts change for patients who are treated with expanders or jaw correctors where the lower jaw is too far back, ADHD levels going down, just a happy-go-lucky kid, growth hormone levels going up. So, if you got kids and you hear them snore, red flag right away. I mean, I would recommend as a very, very concerned parent, have a pediatric ENT evaluate the airway, because it's very hard to have a 14-year-old or 18-year-old or 16-year-old, and you have that window that you can do some expansion and jaw kind of orthodontic movement. Very hard to have them wearing these CPAP machines that can actually cause external facial changes in the anatomy of their face. So definitely look for those patterns in your kids. If they're grinding their teeth, if they're having mouth breathing, more mouth breathers where their mouth is slightly open, they can't breathe through their nose, something's going on, and have the airway evaluated by a pediatric ENT. There's also dentists that look at this as well, that are pediatric dentists now.
Yeah, you put it so well that the investment into developing a young child's jaw really, when a practitioner has kind of thought about this enough, it's like the teeth are secondary. You're trying to get that airway open as much as possible. And you think about the investment that a parent is making into their child. You're helping your child to breathe better for the rest of their life. We've talked about some of the complications that happen down the track. Like, if the amount of people that have obstructive sleep apnea continues to rise, and I think those numbers are pushing kind of the Alzheimer's, because we've got the Alzheimer's epidemic coming up. You've got the sleep apnea levels up here, you've got the Alzheimer's levels following. If we're not making that investment into our next generation, like, this is going to keep going. And like, is there a turnaround for us here? It's very difficult, because as you say, if we're as practitioners identifying it early and making these changes, this can actually potentially severely reduce these numbers potentially in the future. So it's such an important area. You've also mentioned a lot of multidisciplinary kind of into practitioners looking at a patient from many different ways. Tell us about how you change your office, and a little bit about the business side of how you kind of implemented these things into your practice, because you're obviously doing this very successfully. But for dentists out there and for people that are trying to find a practitioner that works the way you do, what were some of the challenges that you went through, and what have you implemented into your practice?
Well, sometimes the dentists feel like they can't even do this, meaning they're not allowed to. Sleep apnea is a medical condition. Who am I to touch this topic? But the oral appliance therapy is always written on a sleep study report as a mandibular advancement appliance, being a course of treatment after CPAP and also with surgical options. And so all dentists, in my belief, if you're graduating with a dental degree, you have an obligation to let the patient know that you see that lower front teeth wearing down, the side of the tongue having those scalloping, the dry mouth issues with the tartar buildup on the lower front teeth, the high arched palate. We call it Mallampati classification. You can look, and if you don't see the punching bag down their throat, that uvula, all you see is a soft palate. You've got to open your mouth as a dentist and ask the patient how well they sleep at night, and plant the seed, even if you're not treating it. So I see this. I've learned that it's associated possibly with sleep apnea issues. I would have this evaluated by a sleep physician, or the next time you talk to your internal care or primary care physician. So even if you don't do this as a dentist, or you're not interested in it, at least talk about it when you know that you see these little signs of the erosion, the wear, and the tongue. And if you are interested in doing it and you are doing it, that communication with these other doctors that you mentioned, the other specialties that are out there in endocrinology and in cardiology, internal medicine, primary care, psychiatrists, because we know depression is linked to sleep apnea, urologist, because it's one of the leading causes of erectile dysfunction when you're not breathing well. What do we learn in meditation, Doc? We learn deep breaths through your nose, right? And exhale. And why do we do that? It's because when you do deep breaths through your nose, you produce more nitric oxide. And nitric oxide is a vasodilator and opens up the blood vessels and puts more oxygen in the blood and calms you, as opposed to tight vasoconstriction and high blood pressure. And so if you're not able to breathe well, your blood vessels constrict, including constriction to all parts of the body. So the urologists are a big referral source for me, because if they have any people getting up to go to the restroom frequently or erectile dysfunction, that can be associated with sleep apnea. Take a sleep test, see how it is. All of a sudden, I've had patients, the 1,700 plus mouthpieces I've made, I've had patients tell me it has helped them with erectile dysfunction. It has helped them with not getting up in the middle of the night. They used to get up 3 times, now once. I mean, wow. And that is such an amazing thing that dentists can do, but it takes the communication and the bravery of a dentist, that when they start screening and seeing the sleep studies that you refer for, or tell them to go to the MD to do the sleep study, and they come back and you make an oral appliance, share the knowledge with every medical doctor in your area that patient has seen over the last few years, and they will in turn have that awareness that dentists can now do it and hopefully refer to you. And that is one big thing how I grew my practice in sleep, is just communication. Communication is important in all parts of our lives. It's my #1 love language. Even though it's not in the top 5, it definitely should be, because if you can communicate well to the MDs and to your patients about what you see and what your findings are, not every single person, Doc, is going to tell you, yes, please help me. And you feel kind of emotionally hurt sometimes, because you're like, do you realize what I'm doing for you here? Do you realize how much I'm saving 12 to 15 years of your life here? I'm lowering your risk of cancer and heart attack and stroke and depression. But it's okay. I mean, knowledge is power. And they'll come back at your checkup next time and, hey, Doc, my wife was telling me that I'm starting to snore. My husband was telling me this and that. And how do you tell me about that mouthpiece you were telling me at that last checkup? And you planted the seed. And I do email blasts. I try to send a newsletter out once a week, some kind of, good information about what's out there with respect to a pillow that helps, or with respect to what melatonin, don't take more than 5 milligrams of melatonin, that kind of positive kind of information, and remind them, by the way, if you know anyone that has sleep issues or anyone that snores, Dr. Rad's doing complimentary consultations at his office. Please call or click here to schedule. And that's really how I've been implementing it.
Mandibular advanced splints, you mentioned that they're mentioned on medical reports after polysomnograph. Are they covered by medical insurance in the US?
So Medicare has a benefit for it, and that's patients that are 65 and over. They have to write that they're not interested in or cannot tolerate a CPAP. That's called a CPAP affidavit. And PPO insurances for medical are covering it as long as the deductibles have been met. Most of them, I would say 75% of medical insurances are covering it. There are some HMO plans that are covering it, but you have to have a specific appliance that's used only by the appliance is called Somnomed, and you have to be, the reimbursements are very low for dentists, so you're not going to find many dentists that provide or accepting the HMO plans that are out here. But yeah, medical insurance, and I teach that in my courses at radseminar.com. I teach all this stuff because that is a fruitful part for dentists, that if you want to dive into medical billing, it's a beast, it's a challenge, but there are medical billing companies that do the work for you and can get you paid. But at the end of the day, it's all fun and games. You're helping someone, and that person will be a patient for life. They may become your dental patient if they were a referral from a neighbor or a friend or a medical doctor, because they see the value that you've added. And the next time you recommend a crown or a filling or an implant, the bond you have with this patient is so high and so priceless that they become so trustworthy of you in this field of dentistry, which is really the connection and the relationship that makes us go in and day out to be able to service our patients.
Yeah, you're really describing the dental practice as being this kind of fundamental pillar between these other health professionals, which are looking at much more severe, conditions, whereas the dental office is trying to get people better, right? We're trying to get people breathing better and sleeping better and feeling better. And like this close connection that a patient has with their dentist. And it's kind of becoming, or could become, like the general practitioner, right? That the dentist is actually the person that, you know, gives you these general tips and these kind of these day-to-day things that help them, you know, on their way getting feeling better and away from their doctor and away from the specialist. You know, because the docs are so busy with all these other things that maybe it is the dentist that can be helping this. You've also kind of formulated a bunch of other solutions, like things like supplements and so forth, and other products that are helping people to kind of get the benefits. Tell us a little bit about how you approach these.
Yeah, so you know, when COVID hit, and I've had patients coming in every 6 months to check their appliance, make sure everything looks good, the screw attachments are fine. I asked them, how's it going, Steve? Everything feeling all right? You know, the work appliance still working for you? Yeah, doc, it's great. I'm not snoring still. Everything's good, but I can't shut this guy off. My brain is, I'm anxious about COVID. I'm anxious about my kids being on Zoom. It exploded to, okay, so what are you doing here? I'm taking Tylenol PM. I'm taking Advil PM. I'm taking Xanax. I'm taking Lunestra, Restrol, marijuana. Monday evening, half a bottle of wine by myself as I Zoom with my friends, and all these remedies that really make your apnea worse. If you're taking any sleep sedative, over-the-counter, prescription, illegal, legal, and you're not wearing an appliance or a CPAP machine, you're definitely, including alcohol, making your apnea worse, because you're making everything, including your tongue, more relaxed and more flaccid and more likely to obstruct the back of the throat. So I got in the driver's seat and I created my own product called RadZzzz. RadZzzz is something that has a unique ingredient in there, and that's called N-acetylcysteine, or NAC. If you just Google NAC and sleep apnea, you will see that the National Institute of Health.gov has done clinical studies to show apnea reduction by about 30% just with that ingredient itself. And I've had patients that have used this and use an Oura ring or some sort of home device that can help look at your breathing and your sleep pattern and see benefits on breathing. It acts as a natural expectorant to remove the mucus buildup that can build up in the back of the throat. So it gives you a little bit more of an anti-inflammatory effect of your airway, along with things like valerian root and L-theanine and magnesium glycinate and tryptophan. All these ingredients blended together are helping the majority of patients fall asleep and stay asleep and breathe better. But if you do still have, you know, sleep issues, you still need to be tested with sleep apnea. This isn't the cure-all for sleep apnea, just because it lowers it by about 30% for most patients. That's been my first product that I came out with. That's been fun to make, because I have a lot of my friends using it and you know, raving about it, because they're, you know, we all have, the mind goes, you know, disarray sometimes, and we keep thinking about what we need to do tomorrow and what we did yesterday. And you know, meditation techniques help. I'm a big believer in breathing and learning how to breathe and calming the mind, and gratitude journaling at night to lower the anxiety. But if you do need a little help, RadZzzz does help, and you can try that.
It's a great way to think about, because if we've talked about all these conditions that are, you know, life-threatening, you know, at their worst, and you know, the harm that it does to the body, to the heart, to the brain, to our digestion and so forth is significant. But so we've talked about some of the ways that we can kind of stop this more severe end of the disease, but then you're kind of thinking, hey, how should we be optimizing our sleep as well? And I really like this idea that, hey, supplements really can help, because, you know, a lot of the research does show that the nutrient levels dropped with obstructive sleep apnea. You can imagine how distressing it is for the body. So some support with some supplements and that formulation that you've made is a great way to kind of get some of those nutrients in that actually help your body to drop into sleep. And I think that's potentially how people could be thinking about it, right? Is that, well, I'm going to do this therapy for some time, but I've got to get myself sleeping, but I've got to get my body producing neurotransmitters, and these kind of nutrients are only going to help that. So it's kind of that dentist being that intermediate, that general practitioner that you're, you know, describing, getting people better, right? And actually having that positive impact, so they don't need the machines, and maybe they can, you know, drastically improve their sleep for the rest of their life. It's inspirational stuff. You've implemented this across your 2 practices in California. Tell us a little bit more about where people can find you.
So my Instagram, Dr. Dar RadHealth, Dr. RadHealth. Anyone can go on there and DM me any questions that you have. I will always answer. RadHealth Inc. or radhealthinc.com is my website for all my products, that are not liver and kidney toxic, like all the other stuff we were talking about that can destroy your body if you're taking on a regular basis. And if you're a dentist out there and you want to be trained and learn how to do sleep, radseminar.com. Everything's rad, in life. We try to keep it fun. And if I can help anyone in any way to help them sleep better, to help them grow their practice, reach out to me. I'm here. I'm in it for the passion. My why is to make sure someone else doesn't fall asleep at the wheel. That would have destroyed my life if I hit somebody or another car. And I'm big on having truck drivers and bus drivers and train and pilots that are tested and wearing appliances that I've made. So, this is an industry thing, and people at work are more focused and doing better sales and more efficient in their practices when they sleep better, let alone the social well-being of being able to sleep next to a bed partner. We're doing some really good things with RadHealth, and I'm really blessed to be able to have this journey to provide all the knowledge that I know so that I can help people live longer lives and have a healthier life.
Absolutely inspirational. You've really kind of showed us how important, this interface between sleep dentistry, and the practitioner that's a little bit more aware of how they can help and how they intervene and really make changes in people's lives. Thank you so much, Dr. Radfar, for sharing this time with us. And yeah, I'd really encourage anyone in the California area to go and see you. So we'll have to have a chat like this soon.
Thank you, Dr. Lane. Appreciate it, bud.
Have a good day.
Bye, everyone.
Bye-bye.